Hi, everybody. I'm Ellen with Advanced Massage Therapies here in Carrollton, Georgia. And today I'm with Sue Tarshis. She has been a client of mine for the past 9 years. And today Sue is going to tell you a little bit about her story, her journey with breast cancer, and with lymphedema. So, Sue, thank you so much for coming.
Oh, you're
Thank you.
welcome. Thanks for inviting me.
Awesome. So, tell me a little bit about your story. Or
Well,
tell them a
tell
little bit
them a
about
little
your
about
story.
my
I know
story.
all about your story. So,
Well, I actually was diagnosed with breast cancer back when I was like 40, 39, 40. I was pretty young, and I had a baby who was still nursing at the time that I was diagnosed. So I underwent mastectomy, and all my lymph nodes, except for maybe one or two, were taken out. And I had radiation therapy and I had chemo, and I am alive today, which is awesome. I am so grateful for that. A side effect, however, of my treatment was that I developed lymphedema in my right arm, which is the arm where all of the lymph nodes were removed. And that, I'm very lucky, did not get terrible, but it was constant. And I had to constantly keep wrapping, and it was annoying, shall we say, to keep wrapping, and it would go up and down. And I was receiving therapy. This was, quite a long time ago, and I lived in Connecticut then, and I had a massage therapist there who did manual lymph drainage for me. But when we moved down to Carrollton, I did not have a therapist. I was sent to a physical therapy group where they had someone who did do some manual lymph drainage but wasn't really a specialist. So I just kept looking around, and then someone told me that Ellen was a specialist in manual lymph drainage. So back in 2017, it turns out, I found her, and she has treated my lymphedema ever since then. I found that it was really useful. My arm came down several sizes in the beginning when we first did treatments. And then it's just so good to have a checkup. Like every month I come and I get Ellen to tell me, yes, it's still on track, or it's a little bit up, or you're a little bit down, or whatever. And it's a great checkup, and it keeps my arm in check.
yes, and that is one of the values of having regular therapy with the same therapist is your therapist will then get to know you, your body, what's normal.
Mm-hmm.
Are you up a little bit? Are you down a little bit? Checking in with you and making sure that your garment is fitting appropriately and measuring you and getting a new garment ordered. And for people who may not know, due to the Lymphedema Treatment Act, every 6 months, insurance will pay for 3 garments per affected area, which is wonderful because we used to have to really fight to get insurance to cover all of that.
Yeah. And I have taken advantage of that. And we were able to get me off of wrapping every day, 2 or 3 times a day, to wearing a garment, which I am wearing now. And look, you can get fancy colors too.
I know. Finally, you don't have
So
to be stuck with just kind
just
of icky
plain,
orthopedic tan.
right,
You can get
exactly.
fun colors.
And I am really grateful to be able to get them through Ellen, because it's easy. She knows the ropes. She knows what to do, how to measure, how to order, and it's great. I appreciate that.
And also, we have you fitted for an appropriate night garment.
Great.
So for those of you who may not know, what you're wearing during the day is not what you wear at night. So there's a whole different garment for compression at
Right.
night, and that sure does beat the bandaging.
Absolutely, absolutely. It's Velcro. It's a big quilted arm garment, and it's got Velcro, and then it has a sleeve that fits over it. So it's easy to use and it provides the compression that I need. So that's great. And I probably should check in to get a new one because it's about time.
That's right. So, um, so we'll do that. And at your next appointment, we will check and see and make sure that we are on target for your next night garment.
Yeah, that'd be great.
Awesome. So, if you were to give advice to someone who has been diagnosed with cancer or is currently going through cancer treatment, what would be some wise words of advice for someone who's been through the process and continues to live post-cancer?
I would say that trying manual lymph drainage would be very key to healing. And I think that there's no way to know until you try it. Try the lymph drainage and see the results. I've heard many people say that it's been wonderful for them, and I know it has been for me. So I would say make an appointment. And one thing I do have to say is not only is the manual lymph drainage healing and useful, it's also very relaxing and it's restful. So it's a wonderful visit to have every month.
I say it's probably the only cancer therapy that feels like a treat. It's really nice. And what I found through many of the people who've come to see me is that it's nice to have the nice relaxing environment. The lymphatic drainage itself is deeply relaxing. And just to have that special time and space to take care of yourself is really, really great.
Absolutely. I do look forward to it every month. Yep.
And then if you are looking for a lymphatic drainage therapist, if you have had cancer, especially if you have had lymph nodes removed and or radiation, and you don't have lymphedema, you are always at risk of getting lymphedema. So you are considered stage 0 lymphedema. And then for people who also have lymphedema as well, you need to see a certified lymphatic therapist who has been through an approved program through the Lymphology Association of North America. It is a minimum of 135 hours training. The Vater School has a minimum of 160 hours training. But to go through and be a certified therapist for lymphedema and for cancer, you need to find a therapist, again, who has been through an approved program through the Lymphology Association of North America. You can visit their website, and they will have a list of approved programs. On that list of approved programs, it's a link to each school's website, and then each school will list their certified therapists. The Lymphology Association of North America also has an additional certification. Generally speaking, massage therapists do not seek that extra certification. That seems to be really within the realm of PTs and OTs. So that's why I encourage, if you are not therapists, I encourage the general public, if you're looking for a therapist, I know it's a little bit laborious, but go to each school's website. Look there. And if you are looking online and you're going through and finding local therapists in your area, do ask about their credentials. Ask about their schooling. Where did you go to school? Who certified you? And how many hours did you get? Was it live or was it online training? Because that really does matter. You need to see a therapist, again, who went through a Lymphology Association of North America approved program for a minimum of 135 hours, and it does need to be live training. That's something that really cannot be taught online, to be able to get very, very specific.
Right.
And the specificity of the hand skills really matters in how effective it is for you.
Well, that's something I do appreciate about you is that you are always going for classes to just renew your certifications, or just to get more information and to get more skills, and then you can bring those home and use different things that are most appropriate for my case. And I do appreciate that.
Well, thank you. And that is another thing. In order to maintain a certification, different schools have either every other year or every 2 years, we must go back and do a recertification training class where they're checking our hand skills, making sure that we're remaining sharp, bringing us up to date on the latest and greatest in what's in research and technology. But I do go above and beyond. I continue to take other classes in lymphatics, and I also teach assist, which helps sharpen my skills and being able to help other therapists. And it's just been wonderful. In fact, this weekend I'm heading off for another lymphatic training.
Oh
So,
boy.
yes, and then later this year I will be back with the Vaughter School, and I will be retraining or recertifying with them as per their requirements. And it is always amazing how much I learn every time I go, even though I've been doing this for about 15 years.
Wow,
Yeah.
that's great.
Well, awesome. I really appreciate you coming, and this has been great. I hope everyone who's watching, I hope this has been helpful, great information. Please, if you have any comments, leave them below. We would really appreciate hearing from you. If you have any questions, leave them below. See what I can do to get them answered. If you're watching this on YouTube, please subscribe to my channel. It really helps it grow. It doesn't cost anything, and it just shows to YouTube that your other people or people are interested in this, and other people would want to watch it, so it'll show that video to more people. And hopefully we can get the word out a little bit more about lymphedema and about lymphatic therapy and how that can be helpful for people who are going through this process. So again, I'm Ellen with Advanced Massage Therapies in Carrollton, Georgia, with Miss Sue Tarshis here. And thank you so much for watching. Have a great day.